Thank you. I promise I will be as quick as possible. Thank you all today for the time to hear on this issue. My name is Shannan Giambrone. I'm a registered nurse at Mercy Suburban. Not true. We've changed our name because we've changed our owner at Suburban Community Hospital in Montgomery County. And I am an executive board member of PASNAP. So you've heard from my colleagues today. Safe staffing is not a new issue, and I think all of you are aware of that. We've been up here many times talking about it. Hospitals have used this strategy. However, it's not just because they can't get nurses into the positions. It is also a plan sometimes, and that's the problem that we're looking at. And between this profit-driven approach and the pandemic, it's driven healthcare workers from the bedside at alarming numbers. And this is a crisis that I have not seen in my 25 years as a nurse. And that's why I'm here today. I represent 9,000 PASNAP nurses and healthcare professionals across the state, and we're here to advocate for our patients. But by extension, we are advocating for all of us. And I want you to focus on my choice of word there, us, because it's everybody in this room. Not one person in this room is going to escape the reality that we will all be a patient one day in a hospital. And we will be sitting there in that hospital, whether it's us or our family member, wondering if because we didn't step up today and solve this problem, we've put somebody that we care about at risk. We have tried to solve this problem with the hospitals. I come from an organized hospital. We sit on committees. We work on problem sharing, but it never comes to fruition, not without some sort of, where's my word? I'm sorry. Not without some sort of legislation that will hold them accountable to the ratios that we all know we need to take care of patients. I'm going to try to address some of the questions that you have and summarize in this. We've talked about rural hospitals and how they're at risk. And we know the Hospital Association is going to talk about that as well, because rural hospitals do need the attention. My hospital, though it's in a county very close to Philadelphia, I liken much more to a rural hospital than I would something in the inner city. We struggle with staff retention, and we struggle with a lower income population. But the difference is with trying to customize your staffing because of where your hospital is, between that and regulations, is that this body doesn't change and doesn't get to be customized by a regulation. Wherever I go, my care has to be the same. You could choose any nurse in this room right now, pick them up and put them in any hospital you find, and they will know how to do their job because the body doesn't change. It's universal, it's undeniable. And to suggest that you could alter the care given to somebody just because of where their hospital is to suggest that those people are worth less care. And health care is equal. It has to be provided equally because that's what the data shows us. Nurses have filed thousands of incident reports. We've let the hospital know that this problem exists. But this is the only thing that can be fixed comes through a law like the Patient Safety Act. If hospitals were truly trying to fix this problem, we wouldn't be here today. Minimum staffing levels of RNs in acute care hospitals are basic regulations. This is not something special that we're looking for. It's basic. And it's necessary for public safety. The fact that they don't already exist is a blind spot in our regulations, but the fact that we'd allow them to continue is unconscionable. Nothing the hospitals could or would say is an acceptable reason for not having a basic safety standard in place. And safety standards are not new. We have them in every industry you can possibly think of. The meat packaging plant needs to package my meat so that it safely arrives to me. Our cars are regulated so that they are safe on the road. I can't drive drunk. All of these things. I'm sure Ford Motor was not thrilled when they had to retool their cars to put shoulder harnesses in the back seat. But we knew it was for public safety, so we did it. And now nobody even thinks twice about it. These are basic regulations. Trying to go fast. Dr. Aiken talked about all of her studies and how we see that these regulations will not only save lives, but they save money in the hospital. Adverse events and complications in the hospital, bounce back admissions, cost hospitals so much money every year. And in addition to that, when I can't do my job properly and these complications occur, they lose part of the reimbursement that they're expecting in the first place. If we give them the tools, if you give me the tools to do my job appropriately, hospitals will retain the revenue that they've negotiated with insurance companies. They have an expectation of what they're supposed to get, but they're not because I don't have the tools to get it for them. That's something that a law encourages a hospital to put in place. Your payroll is always going to be the fastest place where you can save money, but it's short-sighted. It's not going to fix this problem. When a patient comes to me in the hospital, I fix the immediate problem, but while doing so, I look at the root cause, because if I don't fix that root cause, they're going to be back with the same problem. And everybody here understands that. I know that you do. So if you don't fix the root cause of staffing issues in the hospital, you are never going to fix the problems that hospitals are facing right now. And we are all going to be at risk. You have my statement. I've gone completely off. I think you all know that. I'm a little nervous today, and I appreciate your time. But in closure, nurses want hospitals to be successful. This is how we make them successful.
Thank you. Thank you very much, all three of you.
Thank you, Mr. Chair. My questions relate. I only really have one or two, and they relate to the penalty components of the bill. So, in your jobs as nurses, I know from my own time in hospitals that you have various meetings, staff meetings, or administrative meetings to which you have to attend. If a hospital has to choose between sending a nurse to a staff member to a staff meeting and dropping below the minimum ratio, by dropping below the minimum ratio, by sending a nurse to a staff meeting, they would receive a penalty of $1,500 per incident. The hospital also stands to lose $15,000 per day every time they drop below the ratio. All of those fees actually don't go into helping them to hire nurses. They go to the Department of Health, which just goes to the general budget of the Commonwealth of Pennsylvania. So are you concerned that the legislation, because of the penalty component, the way the penalties work, might, number one, disincentivize hospitals from allowing nurses to attend regular staff meetings that are required, and secondly, prevent an additional barrier to the hospitals hiring nurses if, say, 3 violations of the ratio would actually equate to about what 1 full-time nurse equivalent would be for the year?
Okay, so I don't know how long the staff meeting is that I'm going to be at, but I imagine I'll be back on the floor pretty quickly. So I don't know that that's really a significant concern about dropping below a ratio. You know, I step off the floor often throughout the day. So I don't think that that's part of the issue. But I guess my question to you would be, which is the better place to spend the money then? If you're talking about where I don't want this because I don't want to worry about the penalty. If you're losing money one way or the other, isn't it better to invest in your hospital, retain the reimbursement that you rightfully deserve, and give better care to patients? That's what this is all about. If you're staffing the way that this bill would have, then you're not worrying about those penalties at all.